Hello, everyone. Welcome. My name is Raul Melendez, and this is MPA580 Legal and Ethical Issues in the Public Sector. In this presentation, I will provide you with a brief overview of my final paper on ethics training in behavioral health systems. The focus is on comparing compliance-based ethics training with value-based approaches. Behavioral health systems involve complex decision making that goes beyond policy and procedures. I will introduce key theoretical frameworks, explain how these are implemented in practice, recommendations, and provide you with closing or final remarks. Theme 1 compliance based ethics training focuses on the approach grounded in a rule based framework that emphasizes structure, hierarchy, and accountability. These principles are supported by classical administrative theories such as Woodrow Wilson, Frederick Taylor, and Max Weber. In practice, these ideas are applied through policies such as HIPAA, Health Insurance Portability and Accountability Act mandated reporting and fraud prevention. These policies operate within broader systems shaped by federal oversight through CMS, Centers for Medicare and Medicaid Services, state regulations through DHCS, the California Department of Healthcare Services, and county level implementations through RUHS, Riverside University Health System, Behavioral Health. However, empirical research suggests that strict compliance systems can limit professional judgment in complex healthcare environments, particularly in behavioral health settings, as reflected in research by Waina and colleagues. This highlights a key issue, which is that compliance alone does not always align with real world decision making. Theme 2 focuses on value based ethics training. This approach emphasizes human centered decision making and ethical judgment. It is grounded in the work of Mary Parker Follett and the ethical philosophy of Immanuel Kant. In practice, it is applied through scenario based training and reflective discussion that guides decision making in complex situations. Empirical evidence demonstrates that value based approaches improve ethical reasoning and decision making outcomes, supported by research from Conrad and colleagues and Weaver and colleagues, which indicates that while organizations adopt ethic policies, their effectiveness depends on how they are implemented through leadership and organizational practices. In implementation, such as RUHS behavioral health, this approach is especially important at the frontline level where staff must respond to complex client needs beyond policy requirements. As a result, value based training strengthens adaptability in behavioral health systems. Theme 3 focuses on systems and governance. Ethical decision making in behavioral health is shaped by multi level governance systems. This perspective is supported by James Vara. As mentioned earlier, these systems include federal oversight through CMS, state level regulations through DHCS, and also county level implementations through RUHS behavioral health. Policies developed at higher levels influence frontline service delivery, while feedback from frontline practice informs implementation. As a result, ethical decision making is shaped across interconnected governance systems rather than occurring in isolation. This section presents the overall strategy. It compares compliance based and value based ethics training using the frameworks. It draws from works of Woodrow Wilson and Mary Parker Follett to understand both structures and human centered leadership. Based on both theoretical frameworks and empirical research, including studies by Conrad and colleagues, a hybrid ethics training model is recommended. Within implementation contexts such as RUHS, CMS, and DHCS, this model integrates rule based systems with ethical decision making. The goal is to maintain structure while also allowing flexibility in complex situations. These references support the frameworks and empirical evidence used in this analysis and contribution, which will contribute to my final paper as well. In conclusion, ethics training in behavioral health must go beyond compliance to reflect the complexity of real world service delivery. Employees need both structure and the ability to apply ethical judgment in uncertain situations. Integrating compliance and value based approaches provide a more effective framework for public organizations. This hybrid model strengthens ethical decision making and improves service outcomes. Thank you so much for watching.